All right, well, welcome everybody to the session on Nebraska Tribal Public Health Departments. This session is going to be talking about the important work that tribes are doing within Nebraska to improve the health of tribal citizens throughout our state. One thing that we wanted to bring to this conference was to really highlight the important work that's taking place within the tribes. And we felt this was a great opportunity for others to learn about all the work that the tribes are doing and how that fits in with the broader public health system. So today we're going to be having three guests with us. We'll have two individuals from tribal leadership, and then we also have someone from the Great Plains Tribal Chairman's Leader Health Board. And so I'm going to introduce all of them, and then we'll have them go into talking about their work, and then we will go into questions after that. And again, I'm Josie Rodriguez, and I'm the administrator of the Office of Health Disparities and Health Equity. So thank you everybody for joining us in this session. First, we have Mona Zuffante. Mona was with us this morning, and she introduced Dr. Donald Warren. And Mona is a master's in public health, and she's the administrator of the Winnebago Tribe of Nebraska. And as you heard Dr. Warren said, she's also a PhD student in his program. So that is wonderful, Mona. We also have Tribal Chairman Larry Wright Jr., who is with the Ponca Tribe. And then we have Meghan Curry O'Connell, and she's an MD and a master's in public health, and she's a medical epidemiologist as well. And she is with the Great Plains Tribal Leaders Health Board and the CDC Foundation. So first, I want to thank all of you for giving us your time today and sharing with us all the important work that you're doing. So why don't we start off? We'll start off with Mona, and then she'll pass it to Larry, and then we'll finish with Meghan. And they're going to tell us, like I said, about some of the work they're doing, how their health department is kind of structured, and all of the vital stuff that's going on in the health departments. And then we'll have time for questions at the end of the session. And if you would just make sure that you put your questions in the Q&A or in the chat, and we'll be sure to get those answered at the end. All right, I will pass it on to you, Mona. Thank you.
All right, thank you, Josie. So I thought that I would just start off with probably a basic description of our department, which will probably be significantly or maybe a little bit different from other ones. So the Winnebago Public Health Department, as many do, strives to create and maintain a healthy community. And our mission and vision is basically to do everything that we can to reduce the health disparities or impacts on our people. So we have a vast array of programs within our department to respond to those needs. Our public health department consists of about 15 field health programs. We have about 12 employees, or not 12, sorry, 112 employees. Each of our public health department and our tribal health department really is just trying to make things better within our community. And so I thought maybe just a brief overview of all the programs that we have underneath our umbrella. So we'll start with our domestic violence sexual assault program. Provides 30-day on-site housing. We have assistance with basic needs, assistance with safety plans, and referrals to other programs. Our medical services program comprises of our EMS services, which is our emergency medical services, that provides pre-hospital medical treatment and transfers to the nearest hospitals or transfers from our hospital in Winnebago to other areas. And then our community health representatives probably are similar to what you have in the other sector is the community health workers. They take blood pressures, blood glucose screenings, car seat education, distribution. We have our own lifeline monitoring. They also provide a first aid station during our annual powwow. And they also provide transportation to and from our 12 Clans Unity Hospital within the community. They assist with various community programs. They do medication deliveries, case management services. And then our transportation program provides transportation from our 12 Clans Unity Hospital to other medical appointments, such as in Omaha, Lincoln, and also Sioux City and other places as well. They also will pick up our patients if they do not have a ride, if they were transferred from the 12 Clans Unity Hospital, and then they'll bring them back to our hospital here. We also provide a shuttle service between the 12 Clans Unity Hospital and the Urban Indian Center in Sioux City. And they also serve as our medical courier service. So during COVID-19, they provided all of these services, provided transportation to our people, COVID and non-COVID patients. They transported labs to the state lab in the beginning to be able to provide those COVID-19 results, and now to determine if there's variants within our community. They provided hundreds of care packages to our isolation and quarantine families, and now they're assisting with the COVID-19 vaccine response. And then we have about 5 public health nurses. They provide case management of the chronic disease patients, elder care, prenatal assessments, and case management. They do postpartum follow-up, well child care, immunizations and flu vaccines, women's health care, family planning and counseling, school health programs, adolescent health maintenance and education. And then they have been instrumental in the COVID-19 response. They have performed our investigation. They have assisted, or really, they were pretty much the whole hotline. They're performing home tests with people that were unable to come to the hospital. They assisted with basic needs as well for our quarantine and isolation families and individuals, and are now assisting with the COVID-19 vaccine response. We also have our Senior Citizen Center. It provides lunches for seniors Monday through Friday, Meals on Wheels, transportation, legal assistance, and home chore assistance, and have provided they provide about 120 to 160 meals a day, whether that is home delivery or right now we're still doing curbside. Our diabetes program provides a weekly diabetes clinic. We provide staff education. We have a monthly optometry clinic that is directed solely to our diabetics. We have nutrition education, freezer meal workshops. We have lifestyle coaches, pathway case management program, as you might have seen earlier today. Community screenings, diabetes prevention youth services. We have diabetes prevention classes, which are called our Ho Chunk Ho. We have diabetes self-management and education and support classes. And our diabetes team, as you've heard maybe this morning, has also been instrumental in our COVID-19 response by touching base with hundreds of chronic disease clients and assisting with the hotline, and of course now our vaccine. We also run the dental program. And so as dentists do, they have fillings and crowns and bridges and dentures and gum therapy and adult and child cleaning, fluoride treatment. They do sealants in the schools. They do partner with several of the dental schools. We also do root canals, oral surgery, pediatric dentistry, fluoride treatments. And something that's kind of unique is we also provide braces for 18 and below. And we also have Invisalign for 16 and above. And we do a lot of cosmetic dentistry, teeth whitening, and porcelain crowns and veneers. We also have our optometry program that does glaucoma and eye pressure tests, retinal imaging, dilation of your eyes, and we also have glasses and contacts at cost for our membership. We provide a chiropractic service twice a month. Our behavioral health program provides outpatient counseling through inpatient and telehealth services. They have substance abuse counseling and assessments are also conducted. We also assist with transportation to treatment facilities. They are now currently really working with our Educare population. Our Educare, is our 0 to 5 years of age. And so really trying to help those parents understand what Dr. Warren was talking about this morning about ACEs. So those adverse childhood experiences, and trying to help support our parents and children. We also have a health promotions and education program, and we do understand that educating our youth is very important roles, and they are the future of our tribe. So we are teaching right now the Botbend life skills in the classes of 5th through 7th, which gives them the basic tools to achieve healthy lifestyle. Mentoring and demonstrating necessary life skills and instilling self-esteem and pride. And we have several grants that are looking at suicide intervention prevention, meth intervention prevention, promoting self-esteem and behavioral modification in our young population 0 to 5, by teaching our parents again about ACEs and how we reduce those impacts. We have an environmental health program that provides well inspections, lead, radon, water testing, home inspections, food inspections. We also do a pet care clinic. We do have a spay and neuter program because we believe that taking care of our animals is also important because we don't want to have rabies and other animal related diseases. We do vector control, so we do a lot of mosquito fogging and whatnot. We have a tribal safety committee. We also have a very robust fall safety program. They conduct Tai Chi balance classes as well as fall inspections, and they also help, especially our elders, do modifications in their homes. Our health and wellness program conducts youth staying healthy classes in 7th through 8th grade schools. We also have teach the lifestyle balance classes at the college. We have a boys and girls cooking class. We had done a food insecurity questionnaire several years ago. And so we found that our children were eating at our Boys and Girls Club a lot. And so we wanted to know why. And so basically, unfortunately, we thought maybe it was because Boys and Girls had good cooks down there, but the children just didn't have anyone at home to cook for them. And so we decided to start these cooking classes so that would teach the children what foods that they might have in their homes and be able to cook with them for themselves. And then we also have a dietitian that's on staff 3 days a week to provide counseling. And then our Urban Indian Connection tries to do exactly that, networks with urban indigenous people, provide services such as advocacy and connections to those areas in need. They're also working with the schools really to improve that graduation rate for our Indigenous children in the school system. And then finally, our Whirling Thunder Wellness Program is an ongoing youth prevention program. They provide secondary prevention programs, such as to our diabetes patients. They have ongoing adult health promotions programs. We have an indoor pool. We provide youth sports such as softball, basketball, volleyball. And then we also incorporate traditional activities. So we have language, beading, sewing that our children can participate. And then we also have some adult softball leagues. As well as all of this, we have an accreditation team that comprise many of our health directors and staff to work on our public health accreditation path. I think this has really enhanced the good work that I've already described above, but it's really made us redefine and rethink what we're doing. It's really made us engage our stakeholders and our partners using the data that's accessible to us to be really the guiding force as we move forward. So that is pretty much our department in a nutshell. We're always trying to constantly meet the needs of our people, seek out other funding to help support all of these departments for the needs of our people, and also network with other programs, other tribes to see what they're doing and fostering those partnerships as well. So thank you. And I will turn it over to Larry.
Thank you, Mona. I don't know why I thought it was a good idea to follow you. I wish I could say ditto to all the things that she's doing, but our tribe is just in a different place. Winnebago tribe at the hospital and the work that Mona's doing, it's just been amazing to watch and see how they've grown since taking over from IHS. But again, my name is Larry Wright Jr. I'm the tribal chairman for the Ponca tribe in Nebraska. It's an honor to be here today and talk on behalf of our programs. And I can't say enough about the work that our people do in the clinics that we have. We're in a period of some exponential growth for our Ponca health system. For those that may not be familiar with the Ponca tribe, we don't have a reservation. We have service delivery areas, and that consists of 15 counties in Nebraska, Iowa, and South Dakota. And we provide services not only to our Ponca citizens in those areas, but also to natives in general who come in and use our services. Our first clinic, the Fred Leroy Health and Wellness Center, started in Omaha, Nebraska, a little over 20 years ago. And we've had year over year growth in programs and services that we have offered. And a lot of, we have a lot of limitations as well in the number of programs and services that we can offer because currently we are at capacity in the location that we're at. We've been very fortunate over the last few years. We're in the final stages of getting an approved contract with the Indian Health Service for a joint venture construction project, which would essentially increase the space from our current facility, which is about 15,000 square feet. And I should say in that facility, we run all kinds of programs, many of which Mona identified, from behavioral health to a pharmacy to dental, social service programs. Our community outreach folks are second to none. They do a great job with the community and especially with our elders. But there's only so much we can do with the space that we have. But with the joint venture project that we are looking at, we're going to go from 15,000 square feet to essentially about 125,000 square feet in clinic. And for us, that's a $90 million project right now. And we're looking at increasing all of the scope and services that we'll provide in that location, from physical therapy, occupational therapy, pediatrics. We have a pediatrician now on staff that we didn't have before, and looking at all of those kinds of services. And we haven't been able to do x-rays on site, but we will be able to do that. And so we're very excited about that opportunity. And it's been a long work in progress for our location, and just all of the number of services that we'll be able to provide that are much needed for our people there. We do have transportation programs that bring people into the clinic that will help serve their needs. I know our transportation system takes people to Winnebago as well. We have an office site in Sioux City, Iowa, that I know also uses the Winnebago Hospital, and we transport other clients down to there as well. And about 10 years ago, we also expanded our clinic opportunities to Norfolk, Nebraska. So we run a tribal, both of our clinics currently are tribally run, and we have oversight of those. So we have a small clinic in Norfolk, Nebraska, where we also offer dental. We have a pharmacy, and we provide other services there as well. And a lot of our staff actually go back and forth to make sure that we provide those needs. We have a great diabetes program that we have nutritionists and counselors that reach out amongst our communities. They'll either go on site. They're doing a lot more virtual trainings and updates, even on Facebook and those kinds of things. And so our programs continue to grow in those ways. We're also very excited right now. We are working on a new facility in Lincoln, and that will have a clinic there as well, along with many of those same programs. And that'll come online later this year. We're probably looking at September with that, but that will not only create a clinic for our people and others here in Lincoln, but we also will expand our other programs that help feed into our healthcare system. And so we're very excited about the growth that we're undertaking. And unfortunately, a lot of this happened has been ongoing during the COVID pandemic, and just the the commitment from our people, our staff, and being able to be available and be on the front line to help administer the tests and now the vaccines, and even being able to reach out and help. The Santee Sioux tribe had an issue early on and needed help. Excuse me. And we had staff that mobilized to go there and help out with the community. And I think that's at the, at the forefront of the tribes in Nebraska, and especially under our healthcare systems, understanding what it takes and what's needed, and being able and willing to reach out to each other and provide first class healthcare to our people. And that's been one of my goals as tribal chairman. And I know our staff, just because of their dedication, strive to do this every day. But just because it's Indian healthcare, in the past, that's been seen as less than, but none of our tribal citizens or any natives deserve anything than first class healthcare. And I know that's what we all strive to continue to provide, and look for ways to ensure that we're doing everything that we possibly can to provide the best healthcare and the programs and services that our people need. And it's just impressive to hear all the services that Winnebago are doing, but know that those are things that we all look to and continue to look at through all of our programs and services. And our staff continually reaches out to say, we need to do this. And even though they may be overloaded with work and some of the things they're doing, especially during this time with the COVID pandemic, they continue to say our people need more. And we're very fortunate to be in a position, being both in an urban setting and our rural setting, that we have those unique dynamics that we need to continue to look at. And it's through programs and the help of people like Josie, helping others understand the tribe's commitment to our own citizens, but how that also permeates to others. So we in our Omaha facility alone, we serve, we have identified the people that come to the clinic. Over 170 different tribal nations have identified their tribal affiliation that have come through our clinic over the years, and that continues to grow. And we also want to make sure that we want to take care of those that take care of us. And so we're expanding services to our employees, including those that are non-native, and making sure that we're looking at every opportunity to again take care of those that help us, but also to maximize opportunities for and leverage our ability to generate revenue to help continue to provide and expand the opportunities for our people. And whether that's working in conjunction with the state or the other county health systems, that's we've been very fortunate to have good cooperation, but we also want to make sure that we're not seen as less than or subservient to anybody. And I believe the tribal nations in Nebraska have done a very good job of doing that and continue to do better and better. So it's I want to brag about our people more than I probably should, but I just can't say enough how proud I am of all of our people that work on behalf of our tribal citizens in the work that they do. And I said for a long time, they do a lot with very little, but fortunately we're in a time where we continue to look to grow and make our healthcare system stronger than it's ever been. So with that, I will stop and turn it over to, I think Meghan is next.
Thank you so much, Chairman Wright. And thank you all for joining us today. It's an honor to be here with you and, to get to hear about the tribal programs that are occurring in Nebraska. And, thank you both for all of the work that you and your staff and your people have been doing throughout the pandemic. I know it's been a really difficult time for all of us. And I just really appreciate all the work you have done. So I'm going to try to provide a higher level view of how this all fits together and talk a little bit about tribal epicenters or TECs as well. So briefly, my name is Meghan Curry O'Connell. I'm a family physician and let me get this started, and medical epidemiologist with the Great Plains Tribal Leaders Health Board and the CDC Foundation. I've been working with the CDC Foundation and the Great Plains Tribal Leaders Health Board since September, doing exclusively COVID work. But again, I'm going to try to just explain what tribal epicenters are and how all of this fits together in the region and throughout the nation with TECs and tribes and public health and healthcare. I have no conflicts of interest, but I also want to note I'm not a lawyer. I will mention some legal things in here. I'm a doctor, a medical doctor, but not a lawyer. So just throwing that out there as well. So just to kind of put everything into context here, this is a picture of the Indian Health Service areas throughout the United States. The Indian Health Service, or IHS, serves 2.6 million American Indians and Alaska Natives in 574 federally recognized tribes. The IHS has the United States divided up into 12 areas and an urban kind of region, which covers the whole country, where there are urban healthcare organizations. And I point this out for a couple of reasons. One is to discuss a little bit about why this even exists. The Indian Health Service exists to fulfill the trust relationship that the federal government has with American Indian people and tribes. It's a unique relationship within the United States, and it goes back really to the founding of the country and the Constitution. There have been a number of cases and laws that have reaffirmed this special relationship, but it is foundational to the country. And it is why American Indians and Alaska Natives have this healthcare system of their own. The IHS is run in several ways. There are federal facilities where the federal government runs the facilities. There are tribal facilities. You may also hear them called 638 or contracted or compacted services, as you have in Nebraska, where the tribes themselves run their healthcare organizations. And then there are also urban Indian organizations throughout the country. Within the IHS system and nationally, there are also tribal epicenters or TECs that are built around the same structure. So TECs were created by Congress in the 90s, and over time were rolled out so that there is now one TEC for every area within the IHS, putting the number at 12. And the TECs exist to provide support to both IHS and the tribes in public health and the improvement of health for Native people. For this area, for Nebraska, this is the Great Plains area. And so that includes North Dakota, South Dakota, Nebraska, and Iowa, 17 tribes and one tribal community throughout the 4-state region. And the Great Plains Tribal Epicenter serves all of those tribes and tribal communities. And the Great Plains Tribal Leaders Health Board is the tribal organization kind of over the Great Plains Epicenter. So the Great Plains Epicenter is part of the Great Plains Tribal Leaders Health Board. So You also may have heard it called the Great Plains Tribal Chairman's Health Board. There was a name change this fall. That's the same organization. So this is kind of how techs are organized throughout the US and within this region. Tribal epicenters or techs are instructed to provide 7 core functions to tribes. They were instructed by Congress, and anything that techs do is at the request of and in consultation with the tribes, and that can come in a variety of forms. But our mission is really driven by the tribes and tribal needs, and where techs are actually required by Congress to do that. Generally, the 7 core functions that techs perform have to do with public health. So things like collecting data, evaluating healthcare systems and data systems, assisting tribes in identifying health priority objectives, making recommendations about health or public health services, making recommendations on how to improve healthcare delivery, providing technical assistance when necessary, and providing disease surveillance and promoting the public health. So as public health professionals, you're all probably familiar with some or all of these types of functions, and techs are there to work with tribes to provide these functions throughout the region. I would be remiss if I didn't take the opportunity to talk about tribes and techs as public health authorities. This is something that I frankly have learned a lot about, despite working in a tribal clinic and having an MPH and learning a lot about public health and policy. I don't think I really understood the power of public health authority until I started working in the pandemic. So for those of you that aren't familiar with this, having public health authority is really what allows the data sharing to occur between organizations. So between a healthcare organization and say that the Nebraska Department of Health. And this being a public health authority allows the data to flow between those organizations without the consent of the individual. Tribes and techs are also public health authorities. And the reason I want to stress this is because this is essential for tribes and techs to perform public health functions. This is how any of us are able to get data from whatever source, particularly if it contains protected health information. So for example, in the pandemic, if you want to know in your community who has COVID, you need to be a public health authority to be able to have that information, to get that information from clinics and gather it and do something about it. And things like contact tracing and isolation and quarantine. Tribes and techs come at this public health authority from completely different directions. Tribes are public health authorities because they are sovereign nations. It's an inherent part of their existence. They aren't granted public health authority by anyone, by the federal government or anyone else. It's inherent to their existence. Techs, of course, are not governments or sovereign nations. So techs are not public health authorities for those reasons. Techs are public health authorities because they were granted that designation by Congress in what was likely a recognition that they needed this authority in order to do the core functions that Congress wanted them to do. So they were given public health authority or granted public health authority designation in order to be able to access, use, analyze, and share public health data with other public health authorities and with tribes. So I just want to point out some of the challenges that can occur in data sharing. in the way that the current systems are set up. So this is a picture from the CDC about how disease surveillance data can flow. I cut off the half where it says we send data, say from the state to the CDC, that's what's missing. But I highlighted here the local, regional, state public health authorities collect data mainly from clinical providers. So again, for COVID, a local laboratory may do a COVID test and send it off, the results off to the state, and then the state can do something about it. But tribes and techs are not listed on this graph. I promise it's not in the part that I cut off. But they are public health authorities, and sometimes it can be challenging to get all of the data that tribes or techs need to address the public health needs in the community. So, you know, with all of us here, I think, in learning about the amazing programs that the tribes are doing in their communities, I just want to really have a kind of a call to action here to continue to build these relationships. I think this is a great chance to do that, to work on figuring out how to include tribes and techs in these systems more seamlessly, to allow access to public health data so that they can respond to the public health needs of their people even more robustly than they're already doing. I mean, we've heard all the amazing things they're doing already, and just bolstering those responses with even closer relationships and access to public health data is a positive, I think for everyone. So I'm happy to answer more questions about this. I know this is kind of a really high level view. So here's my contact information, but also I'm happy to answer questions as we go forward here. And thank you all for joining.